everyone. Am I audible? Am I audible and visible? Let me check, confirm. Am I audible? Hello everyone, welcome to Unacademy Future Doctors. I'm myself Dr. Deepti Karia. I'm MD PhD Physiology and your faculty for Physiology. Now let me explain in brief about our subscription. As you all know, we have two kinds of subscription. I will explain within 5 minutes. Okay, we have two kinds of subscription, one that is plus subscription and other is iconic subscription. Here, in Plus subscription, you can choose the best from the best. You can access both live and recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can access question bank, which is having more than 25,000 questions. You can compete in the live test as well as quizzes. And with 12 months and above subscription, you will be provided notes too. And in iconic subscription, your access to the best from two of the best. And they are, one is Unacademy and Prep Ladder. With Unacademy here, all the features I have explained, and second, that is Unacademy and Prep Ladder. With Prep Ladder here, you can have clinical and integrated essentials, video lectures from the Dream Team, Question Bank 3 with active guidance, system tags and more, rapid revision and snapshots and treasures and 2021 Dream Notes. Also, we have added certain features in the special class. We made the class interactive. We have a facility of raise a hand, poll for the learner facilities available. You can never miss a class. You can have lecture notes, and you can access the class at anywhere and at any time. Also, we have updated a highly effective question bank, which is having more than 25,000 high yield questions and which are based on latest exam pattern, as well as it has detailed explanation too. These are our NEET PG September 2021 toppers and FMGE December 2021 toppers. Also, we have started Focus FMG 2022 comprehensive batch from December 15th and Target NEET PG 2022 test and discussion batch from December 15th. Also, we have started from 9th February other batches. They are NEET PG 2022 high yield MCQ marathon, Focus FMG comprehensive batch. Also, NEET PG 2022 image based question batch, ultra fast revision batch 2. Okay. Target Next integrated system wise batch 2023, that also has been started from 9th Feb. Okay. Another announcement here is our iconic prices. They drop. You can see here, instead of old prices, these are old prices, these new prices are really attractive, as well as if you use my code DIPTI10, then you will get extra 10% discount. Okay, so here you can you can subscribe from your mobile. Either you can subscribe plus or iconic subscription. Why subscription? Because if you are subscribing, you will get one-to-one guidance from your teachers. You will be provided mentors who can watch on you, who can guide you whenever you require. Okay, so this is very much a good opportunity in this scenario, that in the scenario of internet as well as COVID, so you can easily get benefits of online teaching in this scenario. Okay, so you and one more thing, if you are in first or second year, you go for longer subscription. You can see cheaper are the rates. We also have monthly installment facilities also available. Okay, and one more thing is, if you use my code DIPTI10, then you will get 10% extra discount on each and every subscription. Okay, another few announcements are there, that All India mock test that is powered by Unacademy, that is also on 26th Feb 9 a.m. Okay, this also I told you. Also, Study With Me pediatric test series are also available, that is on 11th Feb, that is tomorrow at 10 p.m. Okay, here rank 1, 2 and 3, they get amazing prizes from Amazon gift vouchers. Okay, now Another, you can take quiz also. You can go to app and you can use this code for today's quiz, that is 345436. So how can you join the quiz? You can see here, you can take a quick quiz, this option, okay? And once you take this option and join quiz, and as you join quiz you have to enter the code. This is old code, today's code is this one, 345436, and you can join new quiz. So this way you can join the quiz too, okay? Now let us start with today's topic, one of the very important topic, with the cardiac cycle, okay? So pressure and volume changes during various phases of cardiac cycle. So first of all, before starting this, let us revise phases of cardiac cycle, okay? We have discussed, I think if you can remember, various phases of cardiac cycle, as let me explain in brief within 5 minutes, okay? So cardiac cycle has, you can see, just I will explain with diagram, schematic diagram, as well as some things which we discussed. If you wish to revise cardiac cycle, that is available in my special class. I have taken special class of cardiac cycle. So if you know this cardiac cycle first, then it will be easy for you to know pressure volume changes, okay? So first, quickly we revise cardiac cycle, okay? So in cardiac cycle, we have two events. One is atrial events and second is ventricular events. Atrial, duration of cardiac cycle is 0.8 second when heart rate is 72 beats per minute, okay? Atrial, again, systole, atrial systole, atrial diastole. Ventricular systole, ventricular diastole. Duration, atrial systole 0.1 second, diastole 0.7 second. Ventricular systole 0.3 seconds, ventricular diastole 0.5 second, okay? Now I will show you with the help of schematic diagram. Here you can see this is the schematic diagram of the heart, okay? This one, right atrium, right ventricle, left ventricle, AV valve, and these are semilunar valves, okay? Now we discuss how these events take place. This, please be attentive here. If you know this easily, you can understand pressure and volume changes, okay? So now starting with the atrial systole, what happens initially when atria and systole? So you can see here, atria, they contract, and what happens when atria are contracting? Blood is rushing from atria to the ventricle, okay? So this phase is also known as filling phase for the ventricle. So atrial systole is equal to last rapid filling phase of ventricle, okay? Very important thing, before that we will discuss about these valves. Your valves, how do they open and close? As I told you, when these valves are one-way valves. One-way valve means when your atrial pressure increases, these valves they open, or ventricular pressure decreases, then these valves open. And how do they close? When your ventricular pressure increases or atrial pressure decreases, okay? Same here about semilunar valve. How do they open? In this direction, pressure in the ventricle increases, or in this aorta and pulmonary vessel decreases. And when do they close? Either pressure in the ventricle decreases or pressure in the aorta or great vessel increases. So this way they open, okay? Now we come to this remaining phase of this atrial event, that is diastole. Now you can see here, atria, after they complete their contraction, now they are relaxing and they are receiving blood. You can see right atrium from superior vena cava, left atrium from superior vena cava and inferior vena cava, left atrium from pulmonary veins, okay? So this is all about atrial events. Now ventricular events, very important thing here we have discussed. Ventricular systole always starts after completion of atrial systole. So you can see here, after atrial systole is over, now ventricular systole starts. So here what happens at the end of atrial systole, because ventricles are getting blood, ventricular pressure increases, and as I told you, when ventricular pressure increases, there is closure of this AV valve, this too, okay? So here, during this systole of the ventricle, first phase is isovolumetric contraction period. Why is it so? Because AV valves are closed and semilunar valves are already closed. So both the valves are closed and ventricles are contracting as a closed cavity. So this is isovolumetric contraction period. This is 0.05 second. At the end of this phase, what happens, because volume will not change and ventricles are contracting, so pressure increases, and when pressure in the ventricles increases, then there is opening of semilunar valve. So here at the end of isovolumetric contraction period, semilunar valves, they open and there is ejection of blood. Blood is ejected from ventricles into the great vessel. So this is initial is rapid ejection phase. Okay, 0.11 second. And third one, that is slow ejection phase, 0.19 second. Okay, so this all completes 0.3 second. At the end of this, now ventricles are relaxing. So first phase here is protodiastole, before the diastole. Okay, 0.04 second, protodiastole. Okay, here what happens, ventricles are relaxing. So because of this, ventricular pressure falls. And as ventricular pressure falls, there is closure of semilunar valves. AV valves are already closed here. Okay, now you can see both the valves are closed again and ventricles are relaxing. So now it is isovolumetric relaxation period. This is 0.08 second. Okay. After that, what happens, ventricles are relaxing as a closed chamber, pressure in the ventricle decreases. So what happens when pressure in the ventricle decreases, there is opening of AV valve here. And when AV valve opens, what happens, there is filling of ventricle. So initially, because atria has high pressure, so rapid filling phase. Filling is fast. So this is rapid filling phase. This is 0.11 second. Okay, followed by, because now atrial pressure decreases, so there is slow filling phase. Okay, about 0.19 second, which is also known as diastasis. Okay, then next is last rapid filling phase is equal to your atrial systole. Because now atria in contraction and remaining blood from the atria are there in the ventricle. So last rapid filling phase, and at the end of this, your ventricular systole starts. That is isovolumetric contraction period because of closure of AV valve. So this is the cycle. This we have discussed. Now we will discuss about pressure changes in the ventricle. Okay, you can see here this curve, this one. This is the curve for pressure changes in the ventricle. Now we will discuss. So starting with here, you can see there are various phases. Atrial systole. Then when atria are in systole, ventricles in diastole. Then comes ventricular systole. You can see here atrial systole is 0.1 second and atrial diastole is 0.7 second. Ventricular systole is 0.3 second and ventricular diastole is 0.5 second. Okay, now, so here you can see what happens to pressure changes in the ventricle. Okay, so now as we have discussed here, your schematic heart. During atrial systole, what happens? Atria, they contract and blood is going in the ventricles. Okay, so there is increase in the intraventricular pressure. Okay, if you can remember the value, that is fine. Right ventricular pressure is 6 to 7 millimeter of mercury in the right ventricle. Okay, and left ventricular pressure is increased to 7 to 8 millimeter of mercury. Always left ventricular pressure is slightly higher. Am I clear? Okay, fine. So here you can see this violet color, this curve, this one, you can see here increase in the pressure during atrial systole. Okay, so this is first phase. Then ventricular systole. When ventricular systole, first phase of ventricular systole, as I told you, isovolumetric contraction period. Both the valves are closed and ventricles are contracting. So what happens? The pressure rises sharply. You can see here this one. Okay, so sharp increase in the pressure. Okay, now you can see here there is one more diagram. It becomes easy for you to understand here by this diagram. You can see this is the volume, left ventricular, this is pressure. You can see here initially ventricles are filled during systole. atrial systole. Okay. Then this one, phase 1. Then isovolumetric contraction. Here what happens? Volume will not change, but ventricles are contracting, so sharp increase in pressure. It rises up to 80 millimeter of mercury here in the left ventricle. Okay. Then next phase, if you can remember, is rapid ejection phase. Ejection of blood. Okay. Here you can see rapid ejection phase. That at this phase you can see pressure rises highest because ventricles are contracting and ejecting the blood out. So this pressure, you can see left ventricular pressure reaches to highest one, that is 120 millimeter of mercury, and right ventricular highest, that is 25 millimeter of mercury. Okay, so this is your rapid ejection phase. Okay, then next is your slow ejection. You can see after rapid, here now pressure starts falling. Slow ejection phase. Why? Because there is no further ventricular contraction. Ventricular contraction. So there is fall in intraventricular pressure. Okay, this one. Now, so here intraventricular pressure starts falling. Then comes your ventricular diastole. You can see here this diagram. This I will show you it with blue colored. I'll show you this one. This is atrial systole, isovolumetric contraction. It rises sharply. Then rapid ejection, again rises. Slow ejection, it falls. Okay. Then during protodiastole also further falls. Why? Because again ventricles are relaxing. Ventricles are relaxing. Okay, so the pressure falls. Okay, now at the end of protodiastole, what happens? Your semilunar valve closes. Why? Because there is now your isovolumetric relaxation phase starts. So again you can see both the valves are closed, AV valve and semilunar, and ventricles are relaxing as a closed cavity. So there is sharp fall in the pressure. You can see here. Okay, this intraventricular pressure falls, and this is, you can see, less than aortic pressure and pulmonary pressure. So this is isovolumetric pressure relaxation phase. When the pressure falls from 80 mmHg, you can see here, this is 80, this one, it falls to around 2 to 3 millimeter of mercury. You can see here only 2 to 3 millimeter of mercury. Okay, so this is your ventricular diastole isovolumetric relaxation phase. Then you can see here rapid filling and slow filling. Here filling is there, so pressure must rise, but it will not rise. Why? Because ventricles are relaxing. Ventricles are relaxing. So in spite of your increase in the filling, pressure will remain slightly above the 0 millimeter of mercury. You can see here, this is the pressure. So this curve is very important, intraventricular pressure curve. Okay, so in both the phases, slow filling and rapid filling, there is fall in the pressure. So this is the curve for intraventricular pressure changes. Next curve, that is for pressure changes in the aorta. Very important thing here is this is linear with the ventricular pressure changes, left ventricular. Okay, because aorta starts from left ventricle. Okay, but important thing here, you can see here, this is left ventricular pressure change, and this is aortic pressure change. What is the difference here? Because left ventricular pressure changes from 120 to 0 to 2 millimeter of mercury. Highest 120, lowest 0 to 2. Okay, but aortic pressure changes are between 120 to 80 only. It will not fall below 80. Why? Because Aorta is elastic. So elastic recoil of the aorta maintains pressure. Okay. And this is aortic pressure changes are recorded by inserting catheter. Okay. Now, which are the pressure changes you can see here along with ventricular pressure changes? Here is your aortic pressure changes. You can see here. Starting with here, ventricular systole. Intraventricular pressure rises. Here you can see in the initial part of ventricular systole, you can see here aortic pressure curve is black color and this is red color. So you can see in initial part of ventricular systole, your ventricular pressure is higher, slightly higher than aortic pressure. Okay, but when your AV valve opens and when blood started ejecting, you can see here rapid ejection phase, and we have discussed, and slow ejection. So at the end of this rapid ejection phase, okay, at the end there is increase in the aortic pressure. Why increase in the aortic pressure? Because aorta are getting filled slightly higher. I will show you the diagram. You can see this is very much clear here. This is your ventricular pressure change, ventricular. Okay, initially this is higher, this one, I'll just sorry, this one is ventricular, this one here. Okay, initially it is higher, but after ejection you can see now your aortic pressure is higher. Okay, you get my point? So aortic pressure is higher, slightly higher, because ventricles are ejecting and aorta gets the blood. Okay, then comes next phase is protodiastole. In protodiastole phase also aortic pressure slightly higher. This is ejection and then protodiastole, slightly higher than the ventricular pressure. Now, and during isovolumetric relaxation period, here what happens, there is closure of AV valve when your isovolumetric relaxation phase starts. So what happens, AV valve, semilunar valves, they close, aortic valve. So what happens, because of closure of aortic semilunar valve, there is collision and there is small and sharp increase in aortic pressure. This is known as incisuria, you can see here, or diacrotic notch, this one, because of creation of collision, turbulence, there is sound, or there is, you can see, notch is found, which is known as diacrotic notch. Okay, then next phase is filling phase. Here ventricles are filled and from ventricle blood goes to aorta, but here aortic pressure continuously falls because blood from the aorta will go to circulation. So that is about 80 millimeter of mercury. Aortic pressure will never be less than 80. Never. Okay, so this is lower limit for the aortic pressure. Okay, then pressure changes in the atria. This pressure changes in the atria, they are recorded with the help of intracardiac catheter. Intracardiac catheter. Okay, and left atrial pressure, which is determined by measuring pulmonary wedge pressure. Okay, we are inserting catheter which is there in the pulmonary vessel, and we are measuring the pressure, pulmonary wedge pressure. And right atrial pressure is measured with the help of jugular venous pressure, JVP. Okay, there are 6 waves in JVP, 3 positive and 3 negative. A, C and V are positive waves. X dash and Y are negative waves. We will discuss what are they. Okay, one of the important topic, jugular venous pressure, may be asked. So intra-atrial pressure, you can see here, these are positive waves shown, A wave, C wave and V wave. Okay, so first is A wave. So during atrial systole, what happens, because atria are contracting, so you can see atrial pressure rises and that gives A wave. Right atrial pressure reaches to 4 to 6, always it is less than left, 4 to 6 millimeter of mercury. Left atrial pressure is about 7 to 8 millimeter of mercury. Okay, and this is during atrial systole. So the name given is A for atrial systole. Okay, so it is recorded as A wave. And in the later part here, when your atria gets relaxed, then what happens? Atrial pressure falls, and that gives negative wave, X wave. Now, next is, you can see during isovolumetric contraction period, what happens? During isovolumetric contraction period, as I told you, ventricles are contracting as a closed cavity. So there is sudden rise in the ventricular pressure. Okay. And because of sudden rise in the ventricular pressure, there is C wave, because your AV valve, you can see here, suppose this ventricular pressure increases, okay, then AV valve bulges here in the atrium. So atrial pressure also increases, and this is during isovolumetric contraction phase. So it is known as C wave. Okay, here. And in later part, then there is fall in the pressure, that gives you X dash wave. Rapid and slow ejection phase, there is fall in the pressure. Why? Because now blood is ejected from ventricle. Okay, so this AV valve bulging decreases. Okay, now next is isovolumetric relaxation period. Here you can see isovolumetric relaxation period. Here again, what happens? AV valves are closed. I'll show you just. Suppose if I am talking about this, AV valves are closed. Okay, semilunar valves are also closed. Okay, and ventricles are relaxing. Okay, but here what happens? Because AV valves are closed, so whatever blood is there in the atria, now it cannot enter in the ventricle. So what happens? This pressure increases, intra-atrial pressure, and this is during ventricular diastole, so it gives V wave, or ventricular filling phase, so V wave. Okay, and then followed by that isometric relaxation period. At the end of isovolumetric relaxation period, what happens? These AV valves, they open, so now blood is entering in the ventricle. And when blood enters in the ventricle, this atrial pressure falls here, you can see. So this way you can explain this ACV waves, one of the very important topic, jugular venous pressure. Okay, JVP. Okay, A, C and V waves, you can see here, these are 3 positive waves, and X, X1 and Y wave. Okay, now next is this, we have discussed volume changes in the ventricle. Here, volume changes, you can see here. When atria are in systole, you can see atrial contraction, because atria are contracting. You can see here, suppose my schematic diagram again has come. So atria are contracting, and when atria are in systole, ventricles are in the diastole. Ventricular diastole ends. So at the end of ventricular diastole, this volume of blood is there, that is known as end diastolic volume. Normal value for end diastolic volume is about 130 to 140 ml. So this much blood is there in the ventricles. Okay, we are talking about intraventricular volume changes. Okay, now after that, you can see here, so most of the feeling of the ventricle takes place during this phase, is feeling phase. Last feeling, that is your atrial systole. Okay, now what happens here? During isovolumetric contraction phase, volume remains same, so you can say volume will not change, steady, 130 to 140 ml. Okay, then ejection phase. Ejection means now blood is ejected. How much blood is ejected? Stroke volume. Okay, we have discussed. stroke volume is your about 70 to 80 ml. So 70 to 80 ml blood is ejected during rapid and slow ejection phase. So how much is left? End diastolic volume was your 130 ml. Minus 70 ml is ejected. So around 50 to 60 ml of blood is left. That is known as end systolic volume. Okay. So here at the end of systole, now ventricles are in diastole. At the end of systole, now ventricle diastole starts. So what happens now? Again, there is feeling. Initially during isovolumetric relaxation phase, there is no change in the volume. Then once AV valve opens, what happens here? Isovolumetric relaxation period, both the valves are closed. But when AV valve opens, then there is filling of ventricle. So now ventricular volume starts increasing. Okay, so here it becomes maximum at the end of diastole, 130 to 140 ml. So during rapid filling, slow filling, and last rapid filling is equal to atrial systole. In all these phases, there is feeling, and as there is feeling, then volume increases. This is important thing. Remember, this is volume, not the pressure. Okay, volume of blood present that we are talking about. Okay, so this is all about today's class. Pressure and volume changes may be asked as your practical, may be asked in your theory as well as MCQ also. So this is one of the very important topic from the cardiovascular system. So thanks for watching me. If you like my video, you can like it, you can share with all your friends, and you can subscribe our channel, Unacademy Future Doctors. Thank you.